Welcome to the Distinctive Dermatologist, the podcast for professionals in dermatology. Our goal is to help your practice stand out and deliver the ultimate experience for your patients, so they schedule repeat visits and refer your practice to their friends. We're here to help your practice become more profitable. Here's your host, 7-time best-selling author, in-residence faculty member at High Point University, Hall of Fame professional speaker, and member of the Sales and Marketing Hall of Fame, Scott McKain.
Welcome to the Distinctive Dermatologist. I'm your host, Scott McKain. And today, a topic of increasing value to your practice. We're going to examine the importance of the cosmetic appearance of your patients and the critical factor of providing what your patients deem as a priority for them to ensure the repeat referral business to your practice. And as always, the Distinctive Dermatologist is brought to you by Gentle Cure from Skin Cure Oncology. Gentle Cure, tough on cancer, easy on skin. So to begin our episode, let's hear from author and business investor Joe Calloway. Joe wrote one of the seminal books on business and customer loyalty, Becoming a Category of One. He brings us an important insight on how customers make their choices and on why he's loyal to his Nashville dermatology practice.
Your patients compare you to everybody that they do business with, not just other healthcare professionals, but everybody. And if they absolutely love their bank, and they have a great experience with their bank, and they don't have quite as great an experience with you, then they're going, why? Why not? Scotty, I've got an appointment with my dermatologist next week.
Oh, really? Yeah.
And I was thinking, and I love them.
Yeah.
I was thinking about why, and it started with when I was first referred to them, I went to their website. Their website was easy to use. Boom, put a gold star up. I went to the map to see how to get to them. The map and directions were clear. The customer, the patient experience had already started on the website. When I called to make an appointment, the call was terrific. The person was efficient, was friendly, was very professional, and pleasure to deal with. And then it kept getting good or even better from there. But people, not just healthcare professionals, but people in any profession tend to think of themselves in isolation, and they're not. They get compared to everybody. Here's a way you can be different. Have everybody in your practice wear a funny hat and a clown nose. Boom, you're different. The best different is to be better. If you're better than the others, your competition, then you are by definition different. But people put so much energy sometimes into what can we do that's different? What can we do that's different? When the key is, what could we do that would make us better? And this idea of constant improvement, which gets, probably as much lip service as any other concept in business or healthcare or any endeavor. That we've got to get better. Okay, what did you do in the last month? Seriously, what did you do in the last month that made your practice significantly better, particularly from the customers, from the patient's point of view? And you think of the last month, it wasn't a good month to ask. We were slammed. We had so much going on. We couldn't really get better. But it's gotten to the point where that's not an option, because believe me, if not all, some of your competitors are getting better. We've got to make ourselves valuable to the customers, not to us, not according to our definition. But, and that now gets into, what do your customers want? And it's dangerous. What do your patients want? And it's dangerous to make assumptions. We know what they want. Well, maybe you do, and maybe you don't. And patient by patient, what they expect and what they want changes as their family changes, as they go through different financial seasons of life. I mean, there's all sorts of variables. From everything that I see, and I think we're in the early stages of AI, but as far as efficiencies for your business, how to be more effective in certain areas with your business, AI can be invaluable. And if you can use AI as a way for you and your staff to personally get closer to your patients, connect better with your patients, then to me, that's the real key. Because just this last week, I was having an exchange with somebody who had approached me saying they wanted to they were interested in what I did, and they wanted to have a conversation about business. I said, fine. We're going back and forth. And after their third message to me in the thread, I wrote back and I said, "This is AI, conversation over." It was a conversation so
Really?
obviously on their end, written by AI, that not only were they connecting, they were destroying any potential of a connection. So it's how can I use AI in a way that makes us more human and more accessible and more connecting with our patients?
As Joe implies, we must realize what's important to our patients, and we might be making some erroneous assumptions. Cleveland area dermatologist Dr. Bob Haber has certainly noticed that patients, and perhaps especially older patients, want to look good longer.
You know, I take care of a lot of young people for hair transplantation and other cosmetic things. You know, we tell our kids to use sunscreen because you want to look young when you're old. And someone will say, well, I'm 40. Why am I going to care what I look like when I'm 40? And it's like, you have no idea how much you're going to care at 40. They think 40 is the end of the world. And we know people in their 60s and 70s and 80s are coming in for surgery and Botox and fillers. They want to look their best. So we're trying to educate the young people so that they don't make the mistakes that we all did in terms of the sun and reflectors and baby oil, but they still do that. But my oldest surgical patient was 84, and my colleagues have done people a lot older than that. So it's not about age. It's not a lifespan. It's health span. It's for one person, 80 is ancient and old. Another 80 is vibrant, and they're impatient because they need to get out and play golf or play tennis or whatever they want to do. And so aging is very different now. And I believe very strongly that I plan to live a long time, and I want to stay robust and look as good as I can, as long as I can. There's an age somewhere in the 30s that some people stop caring, and they drift off here, and they just don't take care of themselves. And other people care very, very much, and they care forever. And those are the people that I love. My oldest active patient right now is 106 years old.
Oh my gosh.
She's a pistol. I love this woman. And she said, by the way, her secret to aging is drinking Evian water. I get no credit. I get no kickback. But she says she drinks Evian water every day. And she's 106. She's cracking jokes. She's having a good time. I said, that's what I want. I might not be playing tennis at 106, but I want to be vibrant. I want to make people laugh when I'm 106 years old and I go to the doctor's office. So, and she cares what she looks like. That's where she's coming in. She wants to do this. I've had, endless patients that want to look good. 85-year-old doc, it's coming to the summer. I got to wear my bikini. How are you going to make my legs look good? And I will do my very best to make them happy.
We'll be back with more on this important issue right after this from our sponsor, Gentle Cure from Skin Cure Oncology.
I started playing golf when I was 10 years old, so I've been in the sun my whole life.
Last year, we noticed a spot on Brian's lip. We were very concerned, and we went to a dermatologist.
When I found out it was skin cancer, I was in the middle of a tournament. The dermatologist was recommending surgery, so I was going to miss time on the tour.
I saw a commercial for a treatment called Gentle Cure. It didn't require surgery and meant no time away from golf.
If you, like millions of others, are affected by skin cancer, it's important to know that surgery isn't the only option. There's another choice, Gentle Cure. Gentle Cure uses low-energy X-rays to kill cancer cells with a 99% cure rate. There's no cutting, no surgical scarring, and no downtime.
Thanks to Gentle Cure, my cancer is gone and I didn't miss any time on the course.
We've been fortunate. We wanted to use our platform to get this message out. There are options, and patients deserve to know.
To learn more, call today or go to gentlecure.com.
And given what we've already discussed today, when a patient is confronted with a diagnosis of non-melanoma skin cancer, what does the data show that's important to them? GentleCure's Chief Operating Officer Josh Swindle has the statistics, and they may surprise you.
There was a recent quality of life and quality of care survey done, and it asked a question. It said, what matters most to patients, right? And I'm kind of generalizing here, but what matters most to patients? And the top three things that matter most to patients are cure rate. That's no surprise. Second most important, avoiding surgery. And third most important is their cosmetic outcome with their intervention. I thought that was just mind-boggling. When you're looking at thousands of patients that have participated in this survey, they want a good cure rate. They want the best cure rate. They want to avoid surgery when they can, and they want their cosmetic outcome to be good. And Scott, I know you and I have talked about some of the, the shift in the human, behavior to become very, very cosmetically sensitive. And this shows exactly that, and when you look at the, 10, 15 items, and these are the top three, it just validates that patients want great cures, they want to avoid surgery, and they want a good cosmetic outcome. I found very interesting as I was actually reading a recently published paper. I'm going to bring this up too so that I don't mess it up, but it's an appropriate use criteria. It was put out by the American Radium Society, and it's an appropriate use criteria for low-dose radiation therapy for osteoarthritis. And I happen to know, one of the authors on there, awesome radiation oncologist, great individual. What was really interesting about this, though, is there was a patient advocate statement in there. And I thought that what a nice shift to have something that is an appropriate use criteria that also involves the patient advocate within their research and, essentially, scientifically backed evidence to say, hey, they are advancing and advocating on modern techniques to make sure that when it comes to everything we do from an appropriate use criteria, that we always have the patient in mind. And so I would highly recommend, any of the listeners to take a look at that paper, because I thought that was such a wonderful shift in published research by physicians that they actually had a patient advocate statement.
Every member of your team is part of that patient journey. For example, the radiation therapist treating the patient has extraordinary engagement with them. As Joe Calloway from GentleCure tells us, his experience displays the importance of this patient-practice relationship.
Unlike a lot of the other professions in the health field where you may see a patient 1 to maybe 5 times tops, and you never see him again, you never find out what happens to him, you're just there explaining the procedure, and that's pretty much it. But with radiation therapy, a lot of these patients, there are patients who will come 40 times for their treatment. So you really get to develop a relationship with a lot of these people. And that's like what I said, that what I truly enjoy about the position is just really getting to know people, their family members, that their grandson is playing a t-ball game Friday night. So, to ask them about that on Monday morning. They know that you like to pick mushrooms and you like mushrooms. So then the patient ends up bringing you a brown paper bag full of mushrooms. So that's something that's really special about this field, is just really getting to connect with patients on a whole nother level. I would say the biggest elements for any practice really comes down to trust and how you build that trust through communication with the patients, respect from the patients, really giving the patients a fully informed consent. I've seen so many times and heard so many stories where a patient comes from another dermatology office because that dermatology office said, all right, you have a basal cell on your cheek, let's set you up for Mohs. And they just say, okay, let's do that. I guess that's the only option. So then they go home, they do their research, they find out that there is a non-surgical option for their basal cell on their cheek, and they come find a practice that offers gentle cure. So they go to that practice and they learn like, oh my gosh, I'm a candidate for this type of treatment. Why didn't my other dermatologist tell me about that? I no longer trust that dermatologist. So now not only has the patient lost trust with a healthcare provider, they found a new treatment and they have gained a lot more trust in a practice that they just randomly found because that practice offers an alternative. We're not saying that Mohs surgery is bad. We're not, no one is saying that, but we just want to make sure that the patient understands that they have options. And if a practice doesn't offer all of those options, you're going to lose trust in that patient.
We've talked a great deal in previous episodes about the ultimate patient experience. As you can see from today's discussion, making it first and always about the patient is what ensures repeat and referral business from your patients. And that's what helps make you a distinctive dermatologist. This is Scott McKain. I'll see you again on the next episode of The Distinctive Dermatologist.
Thanks for listening, and join us next time for The Distinctive Dermatologist with Scott McKain.